Are striking doctors letting patients down? TV presenter James Whale has begged striking doctors to go back to work. Now, he's battling terminal cancer and has months to live. He says, "I need my doctors and they are great, but for those of you who are striking at the moment, you have let us down and let us down very deeply. Please go back to work." James was diagnosed with stage 4 cancer 3 years ago after kidney cancer spread to his spine, brain and lungs. Junior doctors and consultants are halfway through a 3-day walkout over pay. Junior doctors want a 35% pay rise to bring them back to 2008 levels. Belinda, do you think that the doctors are letting us down?
I do. I have huge respect for the medical profession. I really do. But going into the medical profession used to be such a noble cause, about duty, service, putting the patients first. My grandfather was a doctor in the Second World War. He was then sent to the Burma Railway, Japanese prisoner camp, came back about 8 stone. And he was absolutely determined to get back to his community and serve them as a doctor because they were in short supply. But it was a big thing for him because that's where his duty was to his patients. That's why they
paid for that, though, wasn't it? He was appropriately paid for that.
But I think the problem is that if doctors want to be seen as cold hard businessmen and bank managers,
they just want to make enough for a living. I think almost at the point junior doctors are almost earning at the level of retail workers, and it should be much more.
Well, that's only in their first year, and then their scope for a pay rise is huge.
It shouldn't even be aligned in the same realm. It means that supermarkets have acknowledged that the amount of money they need to pay their staff is much higher than it previously was, and the junior doctors haven't caught up.
So, Belinda,
it's a joke.
Do you think that doctors should view their job as a vocation?
I think it goes alongside, because of course it can't just be solely that. They need to earn a living and pay the bills. But what I get quite sad about is that they sort of act as if this cost of living crisis and wage decrease in real terms is uniquely affecting them. It is affecting everyone, or pretty much everyone. You know, people are taking less home because things are more expensive all across the board. It's not just them. I would say also they get a huge amount of job security, better pensions than the average retailer. As I said, they get a huge scope for a pay rise. They go from 30 to 50 quite quickly in 5 years.
But every day they take our lives into their hands, and they come out of university with huge amounts of debts, which somebody that just decides to leave school and work as a barista, for example, doesn't necessarily have.
Well, I think that's an issue that could be talked about. The debt levels, I think, are wrong. But I do think in a cost of living crisis to ask for 35%, such a huge rise, is a little bit, it feels a little bit more political because it's such an unrealistic ask. I think Scottish doctors got a 12% increase and they accepted it and no longer striking. But
that would involve the government getting around the table, really, to have that discussion, wouldn't it, Marvyn, which they don't seem to be doing, which they did in Scotland.
Exactly. So I think it's more of a government problem, because if they got round the table, offered the 12% and the 12% was rejected, then that's a foundation for us to make a counter-argument. But for now, it's very much in the government's hands to create an offer that reflects some sort of real-time increase in the value of their skill set to society, and it's their job to do that in a timely fashion.
But Marvyn, if we get back to actually the fact that doctors have gone on strike, some people would argue that they just shouldn't be allowed to. They take a Hippocratic oath. The army can't go on strike. You know, there are people that aren't allowed to go on strike because they are so vitally important to us, and surely the NHS is one of those services.
Well, I think defending is different to serving our country, and we respect the people who serve our country. We spent literally 3 years clapping for the NHS and everyone that contributes to it. But when it comes down to real change that actually improves their outcomes, helps them with their families, all of a sudden there is no money, there is no conversation about what that needs to look like. It's insane, and I feel really sorry for them.
And if you have a job, if you choose to have a job, which I massively respect, and I think it's an incredible thing for people to go into. If you choose that environment where you literally have the lives and deaths of fellow humans in your hands, and you withdraw that service knowing it's going to cause pain, risk, increase the risk of death, kill people, then I do think there should be restrictions in those types of jobs.
Jeremy made a really interesting analogy earlier on in the show when he said it's a little bit like a fireman walking past a burning building. It goes against every cell in their body. It goes against everything that they feel is right. So when you think about that, what state must they feel the NHS is in for them to have to walk past that burning building in order to get people
that doesn't feel appropriate, because it's not like they drove past in their van with all the equipment and was just like, we don't care. A fireman out of uniform, out of context, is just a man looking at it. And the same thing for a doctor out of context. If you're not going to pay them, if we're so excited and so passionate about how important they are and they save lives, pay them.
Well, I think it's
pay
different
them
to that,
equivalent
Marvyn.
to do so.
When I heard that analogy, what I heard was somebody so distraught that they're having to let that building burn in order to get everybody to be able to see it, to see the problems that are happening within there, in order to try and make it better for the future.
They do have justified concerns, and the government should listen more.
But they're not listening.
But I'm sorry, you're describing a job as if it's so horrific and traumatic, and they're paid so little that they would walk past a burning building or refuse.
We just had a supermarket comparison to a skilled job that takes 7 years to qualify, that you leave a significant amount of debt, that in real terms you are earning less than you were in 2008,
so
and ultimately less than what your grandfather or your father would have earned as a doctor in real time. No, absolutely. For doctors, the highest skilled professionals, it's really important that we look after them and pay them appropriately.
I agree that, but in a cost of living crisis,
at the very least, it's important that we negotiate with them and come to the table, which is not happening.
Amina from London, what's your thoughts on this? I hear you're a midwife?
So I work as a midwife, and my daughter is a junior doctor now in F2 years. Okay, so I work firsthand to see how difficult these junior doctors go through day by day and doing the hours that they do, and they're actually not being recognised for it. So I think that the strike is definitely something that they need to go through it to make sure that they're recognised for what they do, and that we, as a public, support them to make sure that we get the care that we should receive from these people.
I'm hearing that planned cesarean. I'm only saying this because I know you're a midwife. I hear that planned caesarean sections are one of the operations, I suppose they are, that are going to be affected by these strikes. So we're talking about thousands of women that think they are going to have their babies in the next couple of days that will have to delay that. That must be quite terrifying for these women. I mean, how do you sort of justify that then?
I think the fact that they're planned cesarean section, there's an element of safety around that, because we know that these women can probably delay a day or so to make sure that the doctors who are most experienced are there to actually do these operations. But either way, there are emergencies that goes on in hospitals every single day. You have absolutely exhausted doctors that are there that are actually being pulled all over the place. They come into triage on the wards, and these are 25-year-olds with huge amount of debt that they need to pay, as well as going to work. My daughter travels 2 hours a day to work as a junior doctor, so she does 4 hours a day back and forth. She needs to get paid, she needs to pay bills, so this isn't just about being a doctor, it's about the fact that they have to support themselves.
What you're describing there actually is terrible conditions for junior doctors and consultants who are also on strike today and tomorrow. I wonder whether maybe we're focusing too much on pay, or whether the doctors are focusing too much on pay, and whether other things could be considered, like getting rid of the debt from their degrees, or, you know, making sure that junior doctors are put into hospitals that are closer to their home so there isn't a 2-hour commute. Would there be other things that junior doctors and consultants would be willing to negotiate on?
Well, I think that there's always room for negotiation in everything that we do, that there's any form of a disagreement. But I think that the fundamentals today, with the current issue going on with living expenses, the main focus I love my job, but I go to work because I need to pay my bills. That's the foundation of this all. So I think either way, we need to sit around the table, as some of the people have said initially, to get this negotiation and try and meet these doctors halfway, so that we're even a consultant and actually at the point where they need to strike, because they're bearing all the burden and running all these wards that they shouldn't usually have to do, that the junior doctors should be doing them. So I think there is room for a negotiation, but we definitely need to recognise that there's something that needs to be done.
Amina, thank you very much for your call. We're going to speak to Christine now from Middlesbrough. What do you think about the junior doctors and consultants? Are they letting us down?
I'm very disappointed, and I just can't believe this day and age we've got doctors on the street drinking coffee, laughing and joking, and there's poorly people behind them in that hospital suffering. I mean, it can't be overpay. If it's conditions, get to your management. They're mishandling all situations. I mean, the money that's going into the national health We shouldn't be having these problems.
Well,
There's something wrong. It needs reforming from the top all the way down.
Well, the argument would be, Christine, that actually over the last few years there's been a real terms cut in how much the NHS is funded, and that's the issue is compounded by the fact that we don't have enough doctors, we've got an ageing population, we've just been through a pandemic. So you can understand that, you know, on the one hand we're clapping them for putting themselves in the front line during a pandemic, and on the other hand we're not even giving them a pay restoration that would just put them in the same position that they were back in 2008.
Well, the thing is, the government have been through the peer review board. The peer review board have viewed what we don't know about, and they say they've been offered a fair amount. I mean, maybe later down the line, get back around the table. But for goodness sake, for now, stop these strikes every week. People are dying.
Christine, why on earth then is it less than what the Scottish Government has offered them?
Well, that's something that I don't know, and that's what the government need to explain. But they have explained already that the pay board has said this is a fair amount.
Yeah, and they say they're independent.
And they're still striking. I mean, if they offered them 10%, would they still strike? I mean, it's like a pandemic at the minute. Everyone's striking.
Well,
just
thankfully,
get to work,
it's
earn your
not
money,
a pandemic.
Look after the people. I mean, the police.
I understand
I rely on a policeman just as much, but he can't strike.
I understand your frustration, Christine. Thank you very much for your call. Lee from Merseyside, you're up next. Do you think that doctors are letting us down?
No, not at all.
But these waiting lists are getting longer and longer, and they get longer when the doctors aren't in there doing their job.
They do, but I think what people need to consider, I think the doctors really could, the same as the nurses, they could hold us to ransom if they wanted to.
Well, they are.
They're not. If they all walked out, it would take days, and, you know, you can imagine the state the NHS would be in. But look at it this way. If every doctor says, I can either feed my family, I can have a decent quality of life, or I can pursue my passion, my vocation. I'm a mother. I've worked in the NHS for years. If I had to choose, I'd do another job. I'd do a job that maybe I didn't enjoy as much, but I could afford a better quality of life. Why should my family have to do without certain things so that I can look after other people's families?
Well, thank you very much for your call and your insight in that, Lee. I'm going to cross over now and speak to James Whale. James, thank you very much for joining us. I know you are travelling. Just to assure listeners, you are not driving the car. You are a passenger in the car, so you're hands-free and able to chat. James, I mean, it's a really difficult situation for you. And I suppose the first question is, how are you? Are you okay today?
Yeah, I'm having a good day today. I have good days and I have bad days. And today is day one today. But it's one day up, one day down, and there's this. Go on.
We're just losing your signal a little bit. But it's good to know that you're having a good day. How is this strike the next 3 days going to affect your treatment?
In the next few days, it won't affect my treatment. But what I'm concerned about is the amount of people in my situation whose treatment will be affected. And, you know, the BMA have really got to pull themselves together. They're not a political organisation and shouldn't be. And the doctors who are well paid for what they do, a lot of them do extra work, of course, on the side privately. And now they're trying to bring down the government. It's ridiculous. There are many, many doctors who are not taking part in this, don't want to take part in this. But, of course, they're finding it very difficult as well.
But if we're losing doctors at the rate that we are, James, doesn't the NHS have to do something in order to make the government see that they're going to have to change either the wage or their conditions to become globally competitive, so we don't keep training up these doctors and then they just leave to go to New Zealand, so that people like you, because there are thousands of you, people like you get the treatment that you both deserve and treatment that is consistent?
I would agree, but I wouldn't trust the management of the NHS with my toys. And I think that needs to be sorted out first of all. They've got enough money to employ 240 diversity officers, each one apparently paid 3 times as much as one nurse. which seems to me to be a totally ridiculous, stupid thing to do. And so until the management of the NHS and how we want the NHS to go in the future has to be sorted out by just giving them more money. Where do these people on strike who look as if they're having a really good time and very happy about it, where do they think the money's coming from? The money's coming from you and I in our increase in taxes.
We've just heard actually somebody saying that the people on strike are you know, drinking coffee and look like they're having a good time. I don't know how we want people on strike to be, just forlorn and chanting.
You can invent some rain for them to be rained on if you want.
I don't know whether that's a really fair argument, because I suppose they feel themselves in such a distressing situation that they are having to go on strike.
I don't think they're distressed for one moment.
So
I don't think they're distressed for one moment. No, I don't. I don't think they're distressed at all.
You've spent a lot of time in hospitals, far more than I have. In your experience in the NHS in the last few years, you haven't experienced any doctors being overstretched or, you know, going beyond their hours?
I have got a brilliant team looking after me at a London NHS hospital, and they have kept my life going for a lot longer than some people would like, I'm sure.
No.
But yeah, they are feeling a bit stressed, I can assure you, because a lot of people become doctors and then decide they'll go where the highest amount of money is. Great, good luck to them. Maybe we should be making it a little bit easier for people who don't have money, who would love to be in the medical profession, to actually get in and train. And maybe in their contracts, when they've trained, like when you join the military, you have to commit to doing 5 years in the NHS anyway.
Well, all very interesting suggestions there, James. I'm delighted to hear, though, that your treatment hasn't been affected by these strikes, and also that you're having a good day. I wish you all the best and all the health. Thank you very much for joining us for that and for creating the conversation in which we could have had this debate.